Hi, guys. Thanks for joining me. Today, I want to talk about hypothyroidism. I'm currently cuddling on the couch with Luke. He's being really good, so I figured I'd record a video. Hypothyroidism is a condition where the body doesn't make enough thyroid hormone. It's more common in dogs than in cats, but we can sometimes see it in cats. Typically, when we have a patient with hypothyroidism, sometimes they don't have really any clinical signs and we pick it up on routine lab work. However, the majority of patients that we diagnose with hypothyroidism typically have some symptom or some lab work change that makes us want to do the testing in the first place. So typically we'll see signs of a low or slow metabolism, which is often, the cause of the clinical signs. So when you don't have enough thyroid in the body, it actually slows down the metabolism. So in a lot of cases, we can see that pets are lethargic. They may seek heat, so it kind of makes you a little bit cold. They can just be more sluggish. They can gain weight despite not really eating a whole lot, and sometimes, that triggers us to do the testing. They also can have changes with their hair coat. So in a lot of cases, their hair coat becomes really dry. They may lose some hair, especially the fur on their tail. They can present with signs of like skin infections. They can present with, just kind of a dry coat overall. In some cases, they can actually get sick enough that they form edema or actually the development of fluid underneath the skin, and they can, actually have neurological signs from having low thyroid if they get really sick. Other things that we can see with this disorder are going to be lab work changes. So they can have an anemia that's mild, that doesn't respond to treatment with other therapies or supplements. They also can have changes with their blood fat levels, where their blood fat levels get really high. In some cases, they can actually come in with issues with actually having regurgitation, and so low thyroid can ultimately lead to issues, neurological issues as far as the muscles of the esophagus. So thyroid kind of does a number of things throughout the body, and when it gets low, we can see, again, blood work changes, physical kind of appearance changes. We also can see lab work abnormalities and weight gain. So all of those things can cause us to want to test the thyroid. Now, there are some labs that will just add a total thyroid on, and that can be really difficult to interpret. So if on blood tests, especially if you're not suspecting that a patient has thyroid problems, if their thyroid level is low, that actually can be a normal response of the body to stress or other disease. So just having a low total thyroid does not necessarily make you hypothyroid. But if you have a low thyroid and symptoms, then you can believe that. Typically what I do is I want to be absolutely sure that I haven't missed something, and so I always recommend not only just doing a total thyroid, but also pairing it with the free thyroid, so free T4. And that is the active fraction of thyroid. So that's part of what is present in the total thyroid, but it's actually looking at the workhorse of the body. So actually looking at the thyroid that's actually doing something in the body. The other thing that you can pair the thyroid with, if you want to do another way of actually testing, is to measure the thyroid stimulating hormone. And so basically that is the hormone that stimulates the thyroid gland to make thyroid hormone. And what we find in a lot of cases where patients are hypothyroid is their stimulating hormone is saying, hey, I'm not sensing enough thyroid in the body, and so it increases its amount. But the problem is the thyroid gland can't respond, and so we'll see a really, really high thyroid stimulating hormone and a low thyroid hormone. And so that's another way that you can actually diagnose this disease. In some cases, the thyroid, the hypothyroidism will come from autoimmune, so destruction of part of the thyroid. And so there's a number of other blood tests that you can do to try to figure out what caused it. But in a lot of cases, just checking the thyroid and the free thyroid, or the thyroid and the stimulating hormone, are all you need to do to get an answer. The treatment for low thyroid is actually giving thyroid hormone back to the patient. And so that's going to be levothyroxine or thyroxine. It actually is the same form that people take when they're hypothyroid. And so what we do with these patients is we actually give them the hormone since they're not able to make their own. We supplement that, and then we check to make sure that we are getting thyroid level in the normal range. And so what we'll do for follow-up is to actually check the total thyroid and make sure we're in the therapeutic range. Now, the important thing that I always want to remind people is you want to test the thyroid level 4 to 6 hours after a dose. So that's where it's going to be the maximum level, and so you want to get it during that range so you can make sure that you're actually getting where we expect it to be best. And so usually these patients, once we start supplementing them, they do need to stay on it indefinitely because their body is never going to make it again. So it's a really easy disease, very treatable disease. And again, a lot of these patients feel a lot better. They'll get more active. Their hair coat will improve. They won't be as cold. Their weight will improve. So they really just feel better overall. And their blood work abnormalities resolve as well. And so it's a disease that's not a bad disease to have, but it does require lifelong treatment.